Well, it's 8 years now since A Vision for Change was launched. It was a master plan to overhaul our mental health services. A key aim of it was to end the housing of mentally ill people in large-scale institutions and to rehouse them in smaller units or community-based units. So 8 years on, how has it all worked out? Well, I'm joined from our Cork studio by Minister Kathleen Lynch and here in Dublin by Shari McDaid, the Director of Mental Health Reform. Thank you both very much indeed for joining us this morning. Shari, I might go to you first of all. I mean, you know, I know we're going to go through some of the major issues of it, but overall, has this delivered, in your opinion?
Well, we're 8 years into a policy that was due to be completed in 10 years' time, you know, so by 2016. And what we've had is a lot of delays along the way. We're making progress last year in terms of appointing staff, but what we don't have is the full model of care that was put out in the policy. So we don't have a lot of the components that were set out in terms of home-based treatment, in terms of crisis intervention.
Okay, well, let's take them one at a time. I mean, first off, the idea of taking people out of the big institutions and putting them into community care or smaller homes, has that worked? Has that happened?
Well, what we have had is most of the old psychiatric hospitals have now been closed, which is would be a positive development compared to having to go into an old psychiatric hospital. But what we haven't had is the full development of the community-based services that were due to be put in place.
Okay, well, let me bring the Minister in on this. I mean, so, Minister, basically, thank you for joining us this morning, first of all. But basically, we've seen that the large-scale psychiatric hospitals closed down, but the full replacements haven't really been put in place. What would you say to that?
Well, I suppose I'm only responsible for what's happened in the last 2.5 years, and I would agree with Shari that prior to that there were huge delays in the rollout of A Vision for Change. It's an incredible document and it gives the type of detail that we need to deliver a different psychiatric service, and a psychiatric service that does have an element of acute care in it, but nevertheless is mainly delivered in the community with the help as well of primary care teams. It's not just within the mental health area itself. And in the last 2.5 years, as I say, the only time I've had responsibility for it, we've managed to get 90 million in additional resources. We have a recruitment process which has given us additional staff, different type of staff, and we're very careful about what type of staff we are bringing on board.
But Minister, wasn't money delayed? Famously, 35 million was left unspent in this budget. It was pushed into the next year, and even for 2014, the bulk of the spending has been pushed to the second half of the year.
No, that's not true. We've gotten, and it's never been easy, by the way, because mental health, I suppose, for the first time ever, is now competing on a level playing pitch at the cabinet table in relation to resources, and everyone is looking for additional resources. And we have to take this in context. We have gotten this additional money and these additional posts, and by the way, when the rest of the country are being told that they cannot recruit, we have been allowed to recruit. And this is in the teeth of the greatest financial crisis that this country has ever found itself in. And I think people have to accept that as well.
Okay, yes, Mr. Shari, go on.
Yes, but certainly it's true that the money was delayed last year. The money was delayed the previous year due to bigger deficits in the HSE. The money was not spent completely last year. Unfortunately, only 30% of the staff that were allocated for last year are in place yet. And this year, the HSE's own service plan says that they are delaying the recruitment of the 2014 allocation to the latter half of the year. Now, I certainly appreciate the challenges in recruiting large numbers of staff, and you know, I also am pleased to see the new staff coming in. And you know, we're not saying that there aren't challenges there, but we don't want to see the momentum lost. We've had 1 year, last year is really the first year that we've had really substantial recruitment of new staff. And we're still going to be, at the end of last year's numbers, we're still probably going to be near to about a quarter down on what was envisaged. So we need to keep that momentum going, and that's what we don't want to see it stalled.
Okay, so I think. Sorry, Minister, yeah, briefly respond. We have a few issues to get through here.
Well, I think it needs a greater response than that. I think that people don't understand how exactly the process works. It's not as if you're going out and opening a public recruitment process for people to work in an area that anyone can work in. These are very specialised posts, and these are posts that we have to be careful of. And these are people that are going to be working in a changed service, delivering a changed service service into the future, and we're talking about in the next 20 to 30 years. So we have to be careful about what we're doing. We have challenges in some areas, and those areas are around particular posts because we simply don't have enough. But 96% of the posts from 2012 will be in place, and the posts for 2013 will be in place in the second quarter of this year. The posts for 2014, by the way, there is no delay because we haven't started the process of recruitment yet, and we have changed how we're going to do it. We are looking at the regions sending us in their business plan. Where are the gaps? What do you need? And we have to pay particular attention to old age psychiatry and intellectual disability, which are the areas that will get particular attention this year.
Okay, old age psychiatry, intellectual disability. Can I ask, can I bring in the issue of children here? There are still 400 children on the waiting list, and they have been there for over 1 year. Are children still being seen, Shari, from your information, in adult facilities? This has been a huge problem within the mental health services.
Well, the latest public information that we have on that would be from the HSC's performance monitoring reports to the end of September information, was that there had been about 68 children at that time, children and adolescents who had been admitted to adult wards. So that
68 children, what is that, a 9-month period? 68 children were admitted to adult facilities. Minister, what is your reaction to that? 68 children being seen in adult facilities in just 9 months?
It's unacceptable. When we, as I say, 2.5 years ago, there were 16 child and adolescent beds in the country. We're now up to 51, and Vision for Change recommends 60. We will have that. And the other thing we've done in relation to child and adolescent facilities is, out of the 2012 allocation, we gave 150 posts specifically for child and adolescent care, and 80 from the 2013 posts. We're also going to, in relation to the capital spend, again in the teeth of the greatest recession this country has ever seen, we are building a new central mental hospital, and within that there will be a particular unit for children, something that has been long promised but not delivered on, and the planning for that central mental hospital will in fact be going in mid-term this year.
Okay, Central Mental Hospital, will it make a big difference, Shari?
Well, certainly we've been looking for a new Central Mental Hospital facility for many, many years. So, you know, we really need to see that moving forward at this point. It's been a long time we've been waiting for that.
Shari, sorry, could I mean, the notion that sort of we really need to see that moving forward, I mean, clearly it is moving forward, and, you know, all available evidence will tell you, and it is possible to contact the people who actually work in the old Central Mental Hospital, and they will tell you that it's moving forward, and moving forward very rapidly. And I just think that we need to have...
That's very welcome.
Well, that's not what it sounds like.
I'm really sorry, we're going to have to leave it there. Minister Shari, thank you both very much for joining us this morning. Now, there are a number of helplines available if you have been affected by this discussion. These are the numbers for the Samaritans, Console, Aware and Pieta House. All of those numbers are staffed currently.